Dysphagia is a medical condition that involves difficulty in swallowing, a complex process involving the coordinated action of muscles and nerves. This impairment can manifest at different stages of swallowing, from the oral phase to the pharyngeal phase and esophageal phase. Causes: neurological causes. Stroke. Disruption of blood flow to the brain can affect the neural control of swallowing. Parkinson's disease. Neurodegenerative changes in the brain can lead to impaired muscle coordination, leading to dysphagia. Multiple sclerosis. Demyelination of nerves can impact the transmission of signals involved in swallowing. Muscular causes. Myasthenia gravis, an autoimmune disorder causing muscle weakness, including those involved in swallowing. Muscular dystrophy, genetic disorders leading to progressive muscle degeneration affecting swallowing muscles. Structural causes, tumors, growths in the esophagus, throat, or adjacent areas can physically obstruct the passage of food. Strictures, narrowing of the esophagus due to inflammation or scarring can restrict the smooth passage of food. Gastrointestinal reflux disease. Chronic acid reflux can damage the esophageal lining, contributing to difficulty in swallowing. Infections and inflammation. Esophagitis. Inflammation of the esophagus, often due to infections or irritants, can lead to swallowing difficulties. Aging. Normal aging processes can affect muscle strength and coordination, potentially leading to dysphagia. Medication side effects. Certain medications may have side effects that impact muscle function or cause dry mouth, making swallowing challenging. Radiation therapy. Treatment for head and neck cancers can inadvertently damage tissues involved in swallowing. Psychological factors. Anxiety or fear related to swallowing can contribute to or exacerbate dysphagia symptoms. Comprehensive evaluation is crucial to identify the specific cause and tailor appropriate interventions for managing dysphagia. Sign and symptoms. Difficulty swallowing. Sensation of food or liquid getting stuck in the throat or chest during swallowing. Pain. Discomfort or pain while swallowing, which may occur in the throat, chest, or behind the breastbone. Choking or coughing. Feeling of choking or coughing, particularly when trying to swallow solid foods or liquids. Regurgitation. Food or liquid coming back up into the mouth or throat after swallowing, sometimes accompanied by a sour taste. Drooling. Difficulty in controlling saliva, leading to excess drooling. Recurrent respiratory infections. Aspiration of food or liquid into the airway can increase the risk of pneumonia or other respiratory infections. Weight loss or malnutrition. Difficulty swallowing may result in reduced food intake, leading to unintentional weight loss or malnutrition. Fatigue or weakness. Swallowing difficulties can be physically exhausting, leading to fatigue or weakness, particularly during meals. Changes in eating habits. Eating more slowly, taking smaller bites, or avoiding certain foods altogether to minimize swallowing difficulties. Gurgling sounds. Audible gurgling or rattling noises in the throat during or after swallowing. Treatment. The treatment for dysphagia depends on the underlying cause and severity of the condition. Diet modification. Adjusting the texture or consistency of foods and liquids to make swallowing easier. This may involve transitioning to softer foods, thickening liquids, or avoiding certain textures that are difficult to swallow. Swallowing therapy. Working with a speech-language pathologist to perform exercises and techniques aimed at improving swallowing function. These may include strengthening exercises, swallowing maneuvers, and sensory stimulation. Medications. In some cases, medications may be prescribed to address underlying conditions contributing to dysphagia, such as gastroesophageal reflux disease or infections causing inflammation. Surgical intervention. For structural issues like strictures or tumors causing dysphagia, surgical procedures may be necessary to remove obstructions or repair damaged tissues. Botulinum toxin injections. In cases of spastic dysphagia caused by conditions like achalasia or cricopharyngeal dysfunction, injections of botulinum toxin into the affected muscles can help relax them and improve swallowing. Feeding tubes. In severe cases where oral intake is not possible or safe, temporary or permanent feeding tubes may be recommended to provide nutrition and hydration directly into the stomach or small intestine. Lifestyle modifications. Making changes such as eating smaller, more frequent meals, sitting upright, while eating and taking time to chew thoroughly can help minimize swallowing difficulties. Assistive devices. Using devices like special utensils, cups with spouts or straws, or modified feeding techniques can aid in safe swallowing.